Hi, Dr. Malka here, your chiropractor and acupuncturist from Los Angeles, California. And in this video, I'm going to show you how to relieve sciatic pain in seconds while standing. You know, most videos, they show you while you're lying down or sitting, but if you're at a convention hall or standing in line in an amusement park, you don't really have that luxury. Sciatic pain is pain that goes down the back of the leg. It could come from a pinched nerve in the low back or a pinched nerve in the piriformis. And I'm going to show you how to stretch these out both while standing. First off, I'm going to show you proper standing. So oftentimes when you're standing with your knees locked, you'll create an arch in the low back, and that'll cause tension in the low back. So while you're standing, you want to tuck your buttocks, bend your knees a little bit, and then bring your stomach in. And also you can do this by putting your foot up on an object like this, or you can even kind of put your toe up like so. And this will help to create that pelvic tilt. Also, if you're standing and you have pain in the low back, one exercise I have people do as well is to tighten the abdominal muscles, right? Tighten the tummy, tighten the tush, and that'll help take pressure off the low back. Hold that for 10 seconds, release again, tighten the tummy, tighten the buttocks, and that'll help to relax the opposite muscles than what you're tightening, which is the stomach. So let's get into the stretching then. So let's say your low back is involved. What I like to do first is you're going to keep your pelvis perfectly straight like this, and you're going to shift your back from side to side. So you're not leaning like so, you're just doing a shifting. And I oftentimes like to call this the Egyptian. So your shoulders are straight and you're going back and forth and you're doing a shifting exercise. You can do this as well by tucking and arching. Tucking, getting a nice stretch in that low back, and then arching to even it out. And this is basically creating movement in the area, because when those nerves are pinched, it's because you have tight muscles in the low back. And these exercises isolate the low back muscles. So this is all very subtle and gentle. You could do this without people even realizing you're really doing anything. So now let's up it a little bit. We're going on the preface that the pinch of the sciatic nerve is coming from the low back. So next, and you can hold on to a chair if you need, or a table for stability, you're going to just stand flat on your feet and bend to one side. And then come up, and if it's this side, you're going to be bending to this side. And you can see here on this side, I'm holding onto the chair for support. To intensify this stretch, bring your arm up and do the exact same thing, just lean over to the side. And you should feel stretch all throughout this area. And then come back, and if it's this side, go ahead and stretch to this side. It's good to do both sides anyway, just to even the body out. Because you never know, even if it's just affecting one side, it can start tightening up on the other side, and you want to kind of get ahead of the pain. Now, if you feel like this isn't really giving you a great stretch, you can then bring the other side leg behind the body, bring the arm up, and stretch at the same side that the leg is behind the body. And that really intensifies this stretch all up throughout the side. And you can hold these for 10 to 20, maybe 30 seconds. And if at any point it causes you any pain, stop immediately, peel back to the less intense stretch. Let's do the other side. Bring the leg behind the other leg, arm up, and right across the body. And just hold this. And this side feels even a little better for me because I do tend to get sciatic once in a while, and it's always on the left side. The next one is just a simple forward bend. And this is going to create a traction in the low back. And it's just going to help to open up that low back area. Then again, you can hold this for 10 to 20 seconds. Slowly rolling up with the knees bent. You want to protect the low back. Help yourself up with your hands if you need to. And then you're going to arch back. And then when we do the arching back, we want to put the thumbs in that low back area just to create a little stability. Bend the knees a little bit and arch back. And then come up. Use a chair if you need to. You can bring the thumbs up a little higher and arch back. That'll create a pendulum. And you want to put the thumbs wherever the pain is. The pain could be coming anywhere from the segments of the low back, which spans about 4 to 5 inches depending on your height. Now, if you have access to a nice sturdy chair or a sturdy table, this is a great opportunity to do some traction. And you could even use file cabinets if you're standing at the office. So you want to hold like this with the hands, drop the knees, and try to come up on your tippy toes. So basically, the objective here is to lift the legs up. And you don't have to lift them all the way up, but by just lifting the legs up, you're using the weight of your legs to create traction in the lumbar spine. If the pain that you're feeling is coming from the buttocks, then the piriformis is involved, and you'll want to start with these exercises. We're going to put the feet together like so, turn the toes in, and do a twisting. The area that you're twisting in is the area that you're going to be affecting. And then hold this, and if you need to use a chair to intensify the stretch or a table, you can do that. Then come to the other side, twisting and intensifying the stretch by either pushing against the chair or pushing against a table. A nice steady surface. Again, to intensify this stretch, bring one leg forward, one leg back, toes pointed in, and you're going to stretch like so to one side, feeling the stretch in that buttocks. Holding it for 15, 20, 30 seconds. And again, I need to reiterate, if these are painful, stop immediately. And bring the other foot forward like so. And bend towards the back leg, holding it for 10 to 20 or 30 seconds. So now to use a table to create traction in the low back and to stretch the piriformis, you can do as follows. You put your arms like this on the table, and you're just going to lift your legs up. And they don't have to come up all the way, but you're going to lift the leg up, and that's going to create traction in the low back. Or if you need to stretch the piriformis, you're going to bring the leg up like so across the table. And again, if this table's too high, if you have a lower table or a chair, you're going to bring the leg across like this with the back straight. You're going to bend forward, and you should feel a nice stretch in that piriformis. And I'm pretty flexible, so I can go a little further down, but only stretch to your ability, and keep in mind, if it's painful, stop. And if you can't do it, obviously don't do it, because this one is a pretty advanced stretch. Again, bringing the leg across, knee in front of the hip, back straight, and come forward, feeling that stretch in the buttocks. So I know I showed you a lot of stretches in this video. Pick the ones you like and just repeat them over and over until you feel like you're out of pain. So if you like this, subscribe, give me a thumbs up, and I'll address any comments you have. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.